The Big Five of Africa is a phrase used by hunters to describe the 5 most challenging African animals to hunt on foot. Chosen for their difficulty and aggressiveness, their legend is endangered by a new Big Five, just as aggressive but most definitely not a trophy. The new Big Five of Africa: famine, drought, war, political corruption, the AIDS epidemic. AIDS is a global epidemic, but 63% of all people with AIDS live in Africa, an estimated 24.6 million people. In 2006, there were 2.1 million AIDS-related deaths in Africa. This represents 72% of all AIDS deaths that year. This means that one person died every 13 seconds. 23 people died every 5 minutes. 274 people died every hour. 6,575 people died every day. The tragic fact is that more people become infected and die from AIDS in Africa than all other countries of the world combined. A significant threat to the future of Africa is the growing number of AIDS orphans, children who have lost their parents to AIDS. There are currently 11 million AIDS orphans in Africa. By the year 2010, there will be an estimated 20 million. We know the challenges the AIDS epidemic presents. But what are some of the solutions? And what can I do? How can I change one life? Change One Life is a faith-based, nonprofit organization working in Africa to help people with critical health needs know the miracle of good health. Change One Life uses the power of the internet to link people of goodwill to people with specific health needs. Change One Life is a ministry of compassion, motivated by Christian principles, and do not seek to promote any special denominational doctrine. Rather, we simply follow Jesus' example of healing the sick and comforting the afflicted. We partner with clinics and hospitals in Africa to reach those who are in the greatest need of medical assistance. Funds are donated at the Change One Life website and then transferred to the partner hospital or clinic in Africa where the medical procedure is performed. Change One Life made a gift of 20,000 pillboxes in October of 2007 to the Christian Health Ministry of Kenya. This organization is using the pillboxes to help distribute medications to AIDS patients at area clinics within Kenya. A newborn infant is a sign of life, a child of promise in an otherwise broken world, especially in the eyes of an HIV-positive mother. And breastfeeding presents a very real problem, as it could possibly pass on the virus that caused HIV to the infant. The Mother's Milk Project is one of the newest focuses of Change One Life. A $20 donation will buy enough baby formula for a 1-month supply. Baby formula that is prohibitively expensive in Kenya, giving the newborn a healthy start on life and giving the mother added hope for her child of promise. Change One Life will engage the youth of the United States to become involved with fundraising for AIDS orphans. The orphans of parents who have died from AIDS are oftentimes raised by extended family, aunts, uncles, grandparents, ChangeOneLife will fund the construction and staffing of community day care centers where these AIDS orphans can receive the attention they need while giving their extended families the rest they deserve. And one of the most obvious ways to battle the AIDS epidemic is by prevention. Kenyan families pay for their teenage boys to attend a retreat where health and sex education are taught. This is a form of a rite of passage for adolescent Kenyan males, but there is nothing of the kind for adolescent girls. At a cost of about $80 per girl, ChangeOneLife hopes to fund a similar retreat for adolescent Kenyan females. At these retreats, girls will be taught the same valuable lessons on health and sex as the boys, imparting much-needed knowledge to the young women of Kenya. And where there's knowledge, there's hope. The AIDS epidemic in Africa is much too big a problem for any one organization to overcome. But with your help, your donation, ChangeOneLife can make a lasting, positive difference in the lives of people half a world away. Please visit our website at www.changeonelife.org and make a donation today. Please click, give, and change one life.
Somebody sing, hello, 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 Kulumani, Kuluman, Kulumani Siswe, Singan Zenjan, Baya Chapula Basitana, yo.